I think we'll go ahead and get started. It's a couple minutes after 12 here. And I see we have 48 participants, so that's pretty good turnout. I know we have another time that we're going to be doing a similar town hall. I just have kind of a skeleton agenda for you all that I'll be talking through with the, I guess, initial part of the town hall today. And as we've done in the past, and I think most of you have been through these, Ginny Larimore is here to help us with sort of moderating. And if you have any questions you'd like to ask, you can put them in the chat box. If you want to put them in anonymously, that's perfectly fine. Shoot them to Ginny. Ginny, do you want to throw the instructions in the chat, or have you already done that?
Yes, I will do that right now.
Okay. And
absolutely.
And so people can start feeding questions to Ginny if you have some. And obviously, if you have questions as we go along, feel free to ask. I'm going to cover some stuff related to COVID first, and then we'll talk about a few other things, including where our enrollment is, what we're looking like for spring, finals week, spring furlough and plan and finance stuff. So we're going to cover some of that, and that may prompt some additional questions. First of all, I think everybody's aware that the university sets operational levels every Wednesday. The Administrative Council just met a short while ago, and we are staying in the yellow category. Obviously, things are a little different between Bannock and Ada County, but I think our kind of modified yellow is still fitting pretty well with the public health guidance that's going on in the communities that our campuses reside. As everybody, I think, is aware, on October 26th, the governor announced that Idaho would kind of return to a modified stage 3, and our guidelines, our operational status fits well within that, if not even being a little more restrictive in some ways. The COVID trends on campus, the main campus, as well as the branch campuses, it's actually improved a little bit. Last week, as of October 28, we had 52 confirmed cases. I just talked with our COVID health team, and it looks like we'll be in the mid to high 30s this week, which is a bit of an improvement. We're a little concerned that reporting is not what it used to be through the self-report form. And so please encourage your coworkers, encourage your students to utilize the self-report form that's on the Roaring Back website to report any cases of actual COVID exposures, or even folks that are just concerned about a possible exposure or have questions. They can utilize that form, and we'll get some response from the COVID health team. We've added 2 additional staff people to the COVID health team to help with contact tracing and some of those other activities. So hopefully the turnaround time has improved. We've gotten some feedback a few weeks ago that that we weren't getting to everybody, and frankly, it was a volume issue. We were getting between 50 and 100 queries a day through that system, and that's decreased, and we've ramped up our staffing too. The Office of Academic Affairs, the provost, has been working with some of the Roaring Back committees to come up with a subcommittee called the Faculty Impacts Subcommittee. This subcommittee will really just provide some additional faculty input to academic affairs related to the COVID pandemic. So how has this affected teaching, the workload of high flex courses, possible adjustments to tenure guidelines, and we'll talk more about that, at least in terms of stop the clock in a few minutes, and just how to best manage things in the classroom. So you may be hearing from this Faculty Impact Subcommittee, and if you have input for that group that's related to campus operations, particularly related to instruction and faculty affairs kinds of issues, you certainly can reach out to the Office of Academic Affairs. And as I said, this is kind of a subgroup of the other roaring back committees. This one will report up through the instruction subcommittee, which is headed up by Blake Beck and Joanne Tokel. There's been some changes, and I think people have probably seen this guidance, but there's been some changes in our recommendations related to face coverings and face shields. This is really based upon new information as it comes out. The COVID health team tries to stay abreast of new research, new studies, new CDC recommendations that come out. And really the information was that a clear face shield, while we had been allowing that for instruction, those clear face shields are likely less effective than a face covering. And so we've kind of walked back the carte blanche use of face shields in instructional settings to be those where we have either health exceptions in place, we have accommodations in place, or other needs for, such as a medical need for an instructor or a member of the students that are attending that class to have a face shield be used. So we also ask that if face shields are being used, that we really adhere to a good 8 to 10 feet of distancing, if at all possible, in those instructional spaces, because once again, face shields are not as effective as a face covering. And so we would ask that face coverings, a mask, be used unless a face shield is needed for those circumstances that I just outlined. Related to employee travel, under yellow orange, the president's really asked for there to be a stop for all non-essential travel. And essential travel requires VP approval. You can send those up through the divisional office to me, and I'm happy to talk with you about those. We've gotten a few emails from people about travel, and generally those are approved. We talk through what travel is occurring, but we do ask that that it needs to be sort of justified as essential. Candidate travel is also related to this, and so for on-campus interviews, we're also asking that that be approved by the Vice President's office, and that you kind of plan through your selection process to try to minimize the travel impacts and minimize the number of candidates that have to travel to campus. Clearly, Idaho, with our current case rate, we're at we're much worse off in terms of disease activity than many places individuals may be traveling from at the present time. Student travel is similar. We want to basically have all non-essential student travel be held for now. Requests can be made through student affairs if there is a need for essential travel for students, for example, in student organizations. When we talk about on-campus group sizes, we're looking at 10 in terms of on-campus group sizes. That's outside of the instructional activities, but we want to make sure that when we're interacting with the community, we're limiting those groups to less than 10. If there is a need for a group greater than 10, that can be submitted through the health exception process, utilizing the online form. And then finally on this slide, we have a health ambassador team. We continue to have students, faculty, and staff acting as health ambassadors on campus. They walk through high traffic areas, remind people of face coverings, reinforce those that are doing the right thing and wearing face coverings. I think everybody's pretty aware that the numbers of individuals on campus and even attending, especially the high flex classes, has been decreasing over the course of the semester. But if you'd like to be a part of the health ambassador team, you can contact Allison Johnson, and she can get you set up. We have a brief training video, and then she has some supplies and other things to be able to hand out as promotional information about disease mitigation, as well as some little stickers and other things for people that are doing the right things in terms of positive reinforcement. Okay, I'm going to shift gears a little bit and talk about enrollment. This is some of the Census Day enrollment data that's come out. Um, Overall enrollment for fall semester 2020 is sitting at 11,786 students, so just under 12,000 students. This is a decline in undergraduate students of about 7.5%, but that was offset really nicely by a 6.9% increase in graduate students. And I know that you all in the division have contributed to this. We've seen a lot of growth in several of our programs, graduate programs, to help with that almost 7% increase in graduate students. The bulk of the undergraduate student decline is in dual enrollment students. High school students are taking college courses at a lower rate than they normally do. And so when you exclude those students, the dual enrolled high school students, the overall decline was just 2.1%. And so I guess that's the silver lining in this undergraduate number, is that we have we really have not seen a major decrease in the typical college freshman and undergraduate population. It was really an effect that has been complicated by the back to school impacts of COVID in high schoolers who would also be taking dual enrollment. There are some other numbers that I'll share. Idaho transfers, so transfers from other Idaho schools are up 2.9%, and out-of-state transfers are actually up 41%. So some positive trends in enrollment over, if you look at all the nuances of the data, overall still a small decline. And enrollment will likely be an issue in the spring. One reason we asked all of you, and I think Connie sent a survey out to program directors and department chairs to find out kind of the trends that you're seeing, or the concerns that you may be hearing from our students about coming back in the spring. Typically, the fall to spring numbers drop by about 10%. That's built into the financial models of the university. We do know, though, that some students deferred enrollment in the fall and may be starting in spring semester this year. So it will be interesting to see what the net is as we get towards Census Day spring. Obviously, enrollment has an impact on the budget, and I will talk a little bit more about that in a little bit. In terms of spring 2021 schedule changes, as we're coming up to the end of the fall semester here, the first day of classes will begin as originally scheduled on Monday, January 11th. No classes will be held on MLK Monday or on President's Day Monday. The university will be closed or at least no classes and that sort of thing for those holidays. Spring commencement has been moved, and we'll talk a little bit more about that in a minute. Spring break will be April 26 to 30, which is a move from its previously scheduled date in March. I think many programs, especially in the health sciences, have had some questions about that and the impacts that that will have on rotation schedules and otherwise, and those certainly can be sent through for health exceptions or discussed with your dean or with our office at the divisional office if you have concerns or questions about the timing of rotations and other things and how that is impacted by spring break. Following spring break, there'll be 1 week of distance and online-based final exams. That'll be May 3 through 7, and that'll eliminate the need of most students returning to campus. This is a similar model to what we're using in the fall with regard to Thanksgiving break. We know that there are some hands-on testing requirements and in-person exams, and again, those will be allowed with the health exception process. We just need to talk those through and make sure we're doing everything that we can. And then spring semester will end on May 7th. Spring commencement will be on April 24th, which is just prior to that spring break, the new spring break week. EISU fee refund. You all may have heard about this. Similar to this semester, all students will receive a refund of the EISU fees in spring semester as well. That was done for students in the fall, so that I think it's a $35 per credit EISU fee will be refunded to the students. Okay, I think we've already talked about finals week. So what's up with furloughs in the spring? You know, as was announced last May, the university implemented a furlough plan throughout 2021. You all have received correspondence from HR about your need to furlough and how you could handle that. The university asked that we, those that were required to take furloughs, take half of those during the fall, and the remainder will be during the spring. At this point in time, that spring furlough plan is still in play, and we will, move forward with furloughs in the spring based upon the enrollment projections that we're seeing. And so you'll be receiving correspondence from HR about the spring furloughs. That being said, the universities, in fact, all of the universities are working with the governor's office to find out if some of the budget cuts that were incurred by the university might be able to be rolled back. I think you've heard about the tax collections and the statewide budget being in really relatively good shape, in fact, with a surplus as we head towards the end of the year. And so the universities are getting together and working with the governor and the governor's budget office to see if any of the budget cuts that were incurred by the universities could be returned or remanded back to the institutions. That's very much up in the air, and we're not certain if it's going to occur or not. We are currently tracking about a $2.9 million deficit based upon enrollment and other things. That's another reason we're moving forward with the spring furloughs. That 2.9 deficit is off of the FY 2021 budget. And this is, again, due to revenue losses from enrollment as well as auxiliary revenue. As you would imagine, there's been substantial losses in athletics due to no ticket revenue and other things up until now. But I will say that everyone, and the health sciences are absolutely included in this, everybody's doing a great job of managing expenditures. And obviously we're seeing a reduction in travel expenses. And, with the delays in hiring, which has been intentional on the part of finance and business affairs, those salary savings are helping to prevent us from having to take additional budget cuts. There are several other variables that will impact how we land at the end of the fiscal year. Obviously, enrollment is very important. What happens with athletics over the course of the spring, and the availability and receipt of other COVID-related relief funds. And so the university has received some of that. Some of that has been distributed into the programs in the division. And we may see additional funds coming from the feds or the state. And so the Office of Finance and Business Affairs is continually modifying their projections and watching the financial situation moving forward. Is the university planning on another round of layoffs in the spring? No, the answer to that is no, we're not. At this point, the financial state, unless enrollment is substantially reduced, model, but baked into that is a 10% reduction between fall and spring. Unless it's substantially more than that, we've done enough this year to decrease expenditure, to hold on to salary savings and to have our budgets cut, that we should not be seeing another round of layoffs as we move forward. Related to faculty, there's been some surveys out there, and I'd like to get your input during the discussion period about student course feedbacks. There was a survey done towards the beginning of the semester, actually, where Student Affairs did ask several hundred students about their experiences with the courses, and by far and away, the students really appreciated all the work that the faculty did to get ready for fall semester and to have as much in-person and hands-on activity as we could do safely. There were some students that obviously were still concerned about in-person courses, and they appreciated the options that were available to them in places where we could make those options available. So the feedback that's come back from students, at least as of a month or so ago, was really quite positive. There were, you know, some complaints about faculty responsiveness, about interactions via Zoom, and those sorts of things. None of that I recall was directed towards any of our programs within the division. And again, I think everybody's done a fantastic job of online and hybrid learning, as well as doing the best and safest job we can do when we have students in the classroom. So I really appreciate the efforts that everybody has made there. And it was really borne out in the student feedback that was received. In terms of another, I guess, point from Academic Affairs, Academic Affairs has instituted a stop the clock process for those faculty in the tenure track. Obviously, COVID has created substantial challenges for faculty pursuing research. And so we, in Academic Affairs, can offer essentially an automatic approval for faculty that request a stop the clock on their tenure. This would add 1 additional year to the current tenure clock. You can send those requests. There's information on the Academic Affairs webpage, and there was an email sent out to the faculty, but you can send those requests up through the divisional office if you like, and we'll communicate with Academic Affairs and essentially rubber stamp those and approve those because of the crazy circumstances that we've been dealing with this year. I think the email went out to faculty on October 15th that described those processes. A couple of other points, and then we'll try to get to your questions for the last half of the hour here. Winter commencement. And I think you saw the correspondence from Kevin a week or so ago. Very difficult decision, a lot of spirited discussion at admin council about this, but ultimately it was decided that having an in-person commencement was not the appropriate thing to do for the health of our community. I think the group recognized that it would prompt an awful lot of travel to occur with it right next to Halloween, right next to Thanksgiving. It would create a lot of, I guess, compounded travel related issues, encouraging people to travel when really we shouldn't be traveling as much during Thanksgiving. And so given the current state of affairs in our public health districts, admin council decided that winter commencement would be virtual, and it's now scheduled for the end of the semester on December 12th. And I think that Allison Johnson and Libby Howe, the two individuals that are planning graduation and the virtual event, have really done an outstanding job to still make this special and honor our graduates in the best possible way. Out of the several thousand students from last spring, as well as those that would have graduated over the summer and fall, there were only about 300 that had signed up to attend the in-person graduation that had RSVP'd. Now, obviously, there's still several weeks before that date. And so I think the virtual event will come off as special. Obviously, these are difficult times, and we want to honor our students. And so I'm really hopeful that this will still be able to do that, even though many people would have preferred to be in person. It just wasn't appropriate from a public health perspective. And then finally, employee engagement survey. A couple of weeks ago, all employees were invited to take an engagement survey, share how they feel about Idaho State University. This is meant to identify barriers, issues that may exist and that can be addressed. This survey is similar to the one that Kevin had sent out in 2018. Those results from 2018 are available at isu.edu/engagement survey. And with this new survey, steps have been taken to make sure that this is anonymous. There's no contact information requested. All the electronic data are collected by Qualtrics, and that'll be removed and not connected to the responses so that you can feel comfortable providing a very candid response to the questions. Many of the questions are optional. A paper version is also available if you prefer that format. And there'll be an employee engagement task force of faculty, staff, and students to review the data anonymously and make recommendations for improvement. Numerical results and the themes, not individual comments, but that kind of thing that can be anonymized, will be posted online and shared out to the campus once those results are available. So I'd encourage you to fill out that survey and let your perspectives be known. So that is all I have from sort of the canned part of the presentation. And I am happy to answer any questions that folks have. I think, Ginny, you contacted me about a pre-submitted question that someone had asked about cleaning over the Thanksgiving break. There will be cleaning and disinfecting going on over the Thanksgiving break and between the semester. The cleaning staff, the custodial staff on campus has been doing a deep clean in most, especially shared spaces, common areas, and large classrooms about every 72 hours over the course of the semester. And you know, if you have questions about that or concerns that maybe your classroom or academic spaces haven't been cleaned adequately, we certainly could talk about that and engage Cheryl Hansen, who's our Associate Vice President over facilities. But that has been the protocol up until now, that we would have regular deep cleans, including the fogging, which is with a chlorine-based fog to disinfect those spaces on a regular basis. Should have been at least once a week, and my understanding was that it would be every 72 hours in many of those spaces.
Thanks, Rex. A related part two to that question actually is related to whether or not staff, what is the guidance for whether or not staff should be on campus, specifically since classes are ending after Thanksgiving? How should staff and supervisors handle who should be where?
So, you know, obviously it's difficult to talk about this, at least in our current state, in absolute terms. For the most part, the university has been fine with telework. And so in those staff positions where you can effectively telework and communicate with your coworkers and colleagues in an adequate way, telework is fine. Obviously, there are some sort of frontline positions, customer service related positions that need to be staffed. Once the semester ends, I think there will be a decreased need for that, and we can move towards sort of a skeleton crew for those kinds of activities. Provided our work is getting covered and that supervisors are comfortable with that kind of a status, we can move forward with that. So we're not saying that we're going to be totally shut down and that things are going to be closed. I mean, over the Christmas break, we typically do that, but at the end of the semester, that's not going to be the case. But for the most part, we should be operating with a skeleton crew as best as possible to meet the needs of our constituents, whether it's students or colleagues, other departments, or the public. And that should be as minimal a contact as we can get by with and still get the work done in an efficient and appropriate way.
Great, thanks, Rex. Next question has to do with personal travel. So we talked a little bit about official travel. The question is around Thanksgiving and personal travel that people might be taking. Can you walk us through the guidance related to personal travel?
And we're going to send out some additional information about that. Some of it's come from the CDC and otherwise just around holiday travel. The university has said that folks should minimize personal travel just from a public health perspective. Obviously, we can't control what people do outside of work, but I think everyone should be cognizant of the fact that much of the spread of COVID has been related to gatherings, families getting together, parties, people getting together at restaurants and bars. Unfortunately, weddings and funerals and things like that have been a big spreader, super spreaders in some cases, and that will not change over the course of the holidays. And so, I guess from a public health perspective, my recommendation to folks would be to minimize that as best as possible. In our own family, we have a son that's coming home from college, and so we're going to have to manage that and the exposures and potentially quarantining individuals if they're going to be, coming and staying for a while, especially if they're coming from areas where there's high disease activity. And of course, traveling in the state of Idaho, even from Boise to Pocatello or other places, it's high disease activity. So I guess, apart from an official word from the university, from a public health perspective, people should be very, very cautious and very, very cognizant of the risks associated with traveling and maintain disease mitigation and spacing and all of those things as best as possible over the holidays. The university will be providing some additional communication as we get a little bit closer to Thanksgiving that will kind of reinforce some of these concepts. And obviously, with an extended time off, many people are likely to travel. But we want to be very, very cautious as we come back for spring semester that folks are quarantining and isolating as appropriate prior to coming back to work. And again, anytime anybody is ill, they should not be coming into work. They should be communicating with their supervisor, or if it's a student, with their faculty member. And we should be very accommodating to not have people who are ill feel compelled to come to work or into the classroom.
Great. Thanks, Rex. Next question. The university has done an amazing job with keeping us safe and staying on top of cases and preventing spread of COVID. I'm not worried about ISU. Bannock County, however, is seeing rising cases and the entire state is seeing close to capacity in hospitals. Can you talk to us a bit about this regional and statewide crisis and let us know how we can continue to remain safe?
Yeah, it is very concerning. And to be perfectly honest, I'm very relieved that we haven't seen our hospitals overwhelmed up until now. And the mortality that we know has been occurring all along. That being said, deaths and hospitalizations, and I say this in every town hall that I'm in, are a lagging indicator, right? They're behind the curve, so to speak. And so even if COVID disappeared, as some speculated it might after Election Day, even if it disappeared today, we would be dealing with COVID for many weeks into the future. I have a family friend whose mother just got discharged after 17 days in the hospital. So these courses, especially those that are significant and result in hospitalization, frequently are long. And the reality is that just because we're not seeing increased admissions and deaths from COVID today doesn't mean that we won't be seeing that over time. That being said, we are seeing deaths every single day pretty much right now in Bannock County in our health district, as well as in Central District and other health districts across the state. Nearly every day we're having unfortunate deaths added to the total. We still have to do the disease mitigation efforts, and we have to do that outside of work. I think you're right. We've worked pretty hard to do the right things here on campus, and we've had a lot of cooperation, and people have been very, very accommodating under difficult circumstances. That being said, we don't always continue to do that outside of work. And we have social gatherings and interactions and other things. And there will be, as we just talked about, a drive to do that more and more around the holidays. We have to continue to do and be very, very diligent all of those disease mitigation activities that we've been doing up until now. Just because we're not coming to work as much or we're teleworking, when we're out in the community, we have to do our part and encourage others to do the same. So there's no question that we are still in a difficult situation. There's no question that we could still see significant increases in hospitalizations. I think as the weather cools further and we're going to see a significant change in the weather, it sounds like here in eastern Idaho over the next week, people will be indoors. There'll be less activity outside, and there's more chance for spread. I think I'd encourage people to get their flu shot if they haven't gotten their flu shot, because that is another thing that can help to decrease the burdens on the healthcare system over the course of the winter. And I would also say that we've stood up not too long ago a testing subcommittee at the university to begin looking at ways that we could strategically utilize testing, especially in high-risk populations on campus, to then be able to decrease the risk of spread, but also identify clusters sooner and initiate isolation and quarantine procedures sooner. And so we're working on that now that testing capacity seems to be increasing a bit. We don't want to do a lot of asymptomatic testing and screening testing when we can't adequately test those who are ill in our community, right? So there's a moral and ethical issue there. But as we get increased testing capacity, I think you'll see some programs be developed over the holiday breaks here to then potentially see more testing in the campus community. Probably starting with our dorms first. We know that athletics need a lot of testing to be able to compete. And then we'll identify other populations to scale that testing up to hopefully decrease the cases on campus even further in spring semester. So that was a long-winded answer, but there were several different elements that I wanted to touch on related to testing as well as disease mitigation.
Thanks, Rex. Next question, what legislative advocacy action is the university or KDHS doing to influence the release of surplus funds to higher education from the state?
So I appreciate that question. I touched on it a little bit earlier. The presidents of the institutions are working actively on this effort. And I think that it will be interesting to see how this legislative session goes. We know that the governor's budget writers have gotten at least a shade more liberal over the course of the fall as they have seen the tax receipts and the state revenues increase substantially as the economy has picked back up again. So the university is actively working on this. Personally, I have been engaged to work with certain legislators to help with these and other, I guess, legislative touch points and do some advocacy, lobbying, if you will, as this moves forward. Many of you may know that Kent Coons, the university's a lobbyist or a governmental affairs person, retired this summer. And some of his duties have been farmed out to other individuals. And I got some of that. It's going to be difficult to do. We don't know what the legislative session is even going to look like come January, to figure out how we have the ability to communicate with the decision makers in Boise and at the legislature. But I will say that specifically related to our budget cut and the budget surplus present at the state, the university presidents are actively engaged in discussions with the legislature as well as the state budget office to see if any of those funds could be returned to the universities.
Thanks, Rex. Next question, is it possible for there to be a statement from the university, DHS, or COVID task force that clinical programs can send to off-campus placements regarding minimum guidelines we would like to see in place at student placements to keep students and their staff safe? We are having a great deal of variability, inconsistency with follow through with guidelines, lax guidelines, etc. at the placements. Students are taking COVID seriously for the very large part, but the placements are not in some cases, which is putting students in very uncomfortable situations.
Yeah, I think that's a really good point. And I don't know, Chris Owens, I can see you on my screen here. I don't know if you want to join in a little bit about the discussion related to what we expect from our students, but also what our students should be able to expect from those placements. And I think it is a very reasonable question for us to consider as we look at our affiliates, right? As we look at our affiliations and where we're placing students, to have a certain baseline, a certain level of expected disease mitigation and protection for our students moving forward. And Chris, I know you've been working on this project with many of the departments. Do you have anything you'd like to add to that discussion?
Well, I guess I would just say that this exact issue, these kinds of issues are addressed in our assumption of risk document that we have created for all clinical education that at least touches on the issues that we've discussed here, that the site should be a place that observes these kinds of mitigation practices, that encourages those things. However, we have left it largely up to programs and the relationships that inherently exist between a program and their specific sites. I mean, that's really where the interactions take place. But we have built into that assumption of risk document the fact that a student who does feel unsafe or uncomfortable is explicitly told, please let someone know about that. Let your coordinators know about it. Don't just go and feel uncomfortable, but let someone know. If we need to do something more than that, then that's something that I guess that we can discuss with program directors and department chairs and others. If we want to be a little more forceful about what's in this assumption of risk document is now an expectation on all of our sites. We just hadn't taken that particular step yet, but could.
Yeah, and I think the reason we hadn't is because we were concerned about putting an undue burden or demands on those sites and potentially losing sites, because this can be a controversial topic. Sometimes it adds expense, it adds testing, it adds PPE, it adds whatever. But I think it's a great question, and we need to be supporting our students. And if this continues to be an issue where we need to sort of set out the standards that we expect of our affiliations, I'm happy to move that forward. I think it's a great question, and our students need to feel safe. And frankly, our sites need to be following evidence-based and CDC guidelines for protecting healthcare personnel in those settings. That seems to me to be a reasonable expectation of us, of the partners that we have in the community. And so we absolutely could work on some wording or some documentation to be able to provide to those sites if that would be supportive to our programs.
Great, thanks Rex and Chris. So this next question is about process and hiring. Can you please provide us an update on the hiring process for the Dean of College of Health?
Sure. And I saw Chris Brock here. Chris, do you want to tell him straight from the horse's mouth how we're doing with the search for the College of Health Dean?
Yeah, I mean, we're doing pretty well. We've got 6 finalists. We've interviewed 3 of them. Just actually got off a meeting not too long ago. You know, we were the committee was blown away by one of the interviews so far, which is a good sign. And we've got a couple other candidates that we rated really, really highly that are coming up here in the next 2 weeks. So the committee will convene on the 20th to make final decisions on who we invite to campus for on-campus interviews, and then hopefully we can schedule some Zoom meetings in the spring so that everybody gets a chance to talk to those individuals.
Sounds good. And I wanted to thank the committee. Chris has done an outstanding job moving this process along. I've gotten a lot of good feedback about the discussion at the committee level and really appreciate the work that they're doing to move this along and get us a great slate of candidates. So thanks, Chris.
So Rex, that was our last question to date. If there are any additional questions after the fact, feel free to send those to me or to Rex directly. And I will turn it back over to you, Rex, for any, oh, sorry, one last question before we do that. Will these finalists, this is to the previous question, will these finalists be coming to campus or all to visit with?
My hope is that we can get them all on campus and in person and do that as safely as possible, because I think it's extremely important that that we are able to interact with these folks. You know, Zoom only takes you so far in this process. We want to get in the room with them.
Okay, that looks like the last one. Rex, I'll turn it back over to you for any closing thoughts.
Okay, well, thanks a lot. Well, we're getting close to the end of the semester, and I really appreciate the work that everybody's done to get to this point. And obviously work in the classroom, work with our students, work with your colleagues, but also the added work that comes with dealing with COVID. You know, encouraging the right kinds of disease mitigation, doing everything you can. I know many of our programs have been impacted by this in terms of having disruptions in terms of instruction or classes being put on hold for a time and otherwise. And, you know, being flexible, working and supporting our students has been extra work this semester. And I want to thank everybody for doing that. We have done a great job. We should be celebrating the fact that we're really getting down to what, the last 3 weeks or so of the semester. Hopefully we can get through this without major impacts. I know that there have been major impacts, and I know that it has been difficult for all of you one way or the other, personally, professionally, family, dealing with kids at home. My kid was just sitting across the table from me here doing his math, and I had to tell him to take his lecture upstairs because we didn't want to hear his math teacher in the background of this conversation. But it's just been a very, very difficult time, and I want to just thank all of you for the work that you put in, additional work that you put in to make this work. And those of you that have taken on additional assignments, and Chris Brock is a great example, the other members of the search committee, you know, being a part of an important search like this, being a part of some of the committees that have been created on campus here as additional work, you know, it's difficult. I know that my work has been very, very much impacted by the COVID response. And, you know, we're trying to get back to the business of the division. And it's really difficult when things change day to day to day within the you know, environment that we're working in. Patty Marincic, Chris Owens, much of your leadership team has seen an erosion of the day-to-day work filled in with heaps and piles of COVID-related work. And I know that that's happen to most people. So thank you all for the efforts that you've done. I know it's going to be a difficult and in some ways potentially disappointing holiday season because of, you know, the lack of parties and the lack of, I miss our Christmas get-togethers and things like that. And so I would ask that everybody stay safe, be healthy, enjoy the holidays in a small group, and let's get through the rest of the semester and recharge a bit over the break to be ready for spring. Thanks to all of you, and we'll talk to you soon.